we're live, and this is for our search class. Today, we're talking with Kaitlin Costello, and Kaitlin is on our faculty here at Rutgers. Kaitlin, can you tell us a little bit about yourself and your background?
Sure. So I'm Kaitlin Costello. I'm an assistant professor here at Sky. I'm in the Department of Library and Information Science. I recently received my PhD from the University of North Carolina at Chapel Hill at their School of Information and Library Science. And for my research there, I mostly focused on how patients both search for and then what motivates them to disclose and share personal health information online. So I've done a fair amount of research into online support groups, specifically in the context of chronic kidney disease. And I'm mostly interested in what information patients are searching for online, how they assess the credibility of the information that they find when they do find information online, and then how they use that information to make decisions about their care, to cope with uncertainty, to satisfy curiosity, and so on. So that's sort of a brief background. In my previous life, I worked as a paraprofessional at a law library. I've been working in libraries since I was 14 years old. I've never left the field once I started, and I did my master's degree at the University of Illinois at their School of Information and Library Science, and I studied digital curation there, and I have a certificate in special collections from their program as well. So that's me.
Wow, that's great. So you are uniquely able to help us with some of the questions that we have about health search today. So, okay, so what kind of buckets would you say health searchers ought to know about as they approach health questions with users? Are there various different types of approaches to searching for health information?
Definitely. I think that the sort of two major maybe buckets or camps you might think about are health professionals and acting as a proxy for health professionals, so doctors, nurses, social workers, that sort of side of things, technicians, and then also consumers of health information, so patients, people who might come in and have questions about their own health, or again, they may be acting as a proxy for somebody who they're caring for. So at that point, you have sort of the two layers, right, where somebody's coming in with a question for someone else, and then you are also trying to help them translate that question that they might have for this other person in order to find information that's relevant to them. So I would say broadly, professionals and consumers.
So there's that kind of dichotomy, and I remember when I was at a public library, I very frequently got health questions, and I felt a little shy about how I should respond exactly. So maybe we should start with that, the consumer health kind of thing, and the kind of generalist librarian. Any advice in terms of that kind of setting?
Yeah, I think the first thing to always sort of keep in mind is that we are information professionals, not health professionals. So making it clear to patrons that you can't give them medical advice, but that you can point them towards resources that might be helpful to them, especially stressing maybe that they might want to talk about these resources with their healthcare providers is, I think, a really important role that we can play. In some of the research I've done, I've found that at least the participants in my studies generally do like to bring information into a doctor before they do anything with it that's related to their care, but that might not always be the case. And so I think that one of the things we can really make sure that we do is make that clear to our patrons, that we're not medical professionals, that we can give advice, but not, we can't really give medical advice. We can give informational advice about what resources might be appropriate for them.
So when you do that kind of leading users, students, patrons to that kind of, those kinds of resources, what are some of your favorite go-to spaces, depending upon, of course, the user's needs? Do you have any recommendations?
Well, like you say, it really is dependent on the user's needs. I really like Medline Plus, and let me see if I can pull that up here so you can sort of just see what it looks like. Medline Plus is basically the consumer-facing sort of version of Medline. They have a lot of really nice health information here, and one of the things I like about it is that it's legible and readable by a wide variety of people. So one of the issues that you get into pretty quickly with any kind of specialized information resource is that the language might be difficult to understand for people who aren't sort of, part of that, world or part of that community, right? So Medline Plus does a really nice job of translating health information for the general public. So let me try to share this site with you.
How do you compensate for that lack of subject area knowledge? This is one strategy, right? The lack of vocabulary and limited context?
Mm-hmm. Yeah, definitely. So looking for sites that are geared towards, a broader audience is one way. Another thing I really wanted to show you guys, and let me know if this shows up, is the mesh browser. Is this available?
Yeah.
So this is one of my favorite things when I'm searching for health information or showing people how to search for health information. The mesh browser is basically it's basically the controlled mesh vocabulary that's used in Medline and that's used by a lot of journals when they actually catalog articles that are in the medical literature. And one of the things I really like about the mesh browser is you can actually put in a term, and it will find the dictionary terms that are related to the thing that you're looking for. So for example, a good example might be kidney. And we can actually see here that brings us to the mesh heading, which is kidney. But down here we can sort of see all sorts of see alsos, right? We have a nice scope note here. And this is a really great thing that they do in the mesh browser, is that we can actually see here a bunch of different mesh terms in the annotation that are related to the topic, right? And then down here, you can actually see where the term lives in the tree. So if you're thinking about a health question that somebody is giving you with the National Institute of Health, needs to be open access. So a lot of that stuff is now coming into PubMed. But yes, you're right. It's not something that not all public libraries will have access to the articles that are indexed in Medline. But it is good to know sort of what's out there. That's another reason I like Medline Plus for this kind of search. It's really linking to it. The content is all there. It's not linking out to content that you may have to pay for or you may have to find on your own the way Medline does.
Gotcha. So in terms of, there's just so much out there in terms of consumer health, and you've mentioned a couple of resources. What else would be on your top 5 list, say, for somebody who is a patient or somebody who's just doing some general health research?
Well, it really sort of depends on the question, but one of the things that I've found is that a lot of time consumers or patients are really interested in finding sort of more emotionally based, personal story type of information. They're getting a lot of that factual medical information from their providers. And on top of that, a lot of times the factual sort of medical literature that's available online through Medline Plus or through something like WebMD, right? Or even PubMed in some cases, a lot of that stuff is general. The information is it doesn't go very deep into some of the stuff that patients might be interested in. And actually there have been studies that have found that the information that's available online about health is at a sort of a surface level. So a lot of times people need to go to their doctors for that stuff, and that makes sense, right? So a lot of times when patrons are looking for, or consumers of health information are looking for health information online, they're doing one of two things. They're either trying to find similar patient stories, or they're doing sort of a just-in-time type of search, right, where they're experiencing a particular issue with their health at that moment, and for whatever reason, they can't talk to the doctor about it, right? So for the first type of question, I would really encourage people to look for online support groups or virtual communities that are geared towards that particular illness, because that is where a lot of those stories are living. So another really popular site that might be appropriate to recommend people check out is the site Patients Like Me. So I can bring that up here. And Patients Like Me was created several years ago by two brothers. It was created in 2005 by two brothers. Their third brother was diagnosed with ALS. And they started looking for information about ALS, and they weren't really able to find what they were looking for. So they said, you know, wouldn't it be great if we could find other people who are going through ALS and try to understand what medications they're taking, try to understand what their side effects are, right? So this is a really interesting site because it actually, as you can sort of see what they're trying to do here with this little graph, it actually tracks the patient health record. So you can have your personal health record. It's not your electronic medical record. It's more the data that you're keeping about your own health. And you can actually track that along with these forums that they've created. So you can actually connect with other patients. And they use a lot of that personal health information that you have given them to find and connect you with other patients who are like you. So you can use, they have a faceted search and browsing system that allows you to actually say, okay, I want to find patients, for example, who have had a kidney transplant and who are taking the same 3 medications that I'm taking, and it will show you their profiles, and then you can message them or see them on the forums, right? So that's the kind of thing where finding patient stories, that's a really nice site for something like that. And there are a wealth of different health online support groups out there. This is one that's more general. Any health condition usually has at least a few to many patients on Patients Like Me. But then there's also sort of more homegrown, sort of by patients for patients types of systems. The one that with which I'm most familiar is a website called I Hate Dialysis, and it's an online support group for people who are going through kidney disease, who are many of the patients there are on dialysis, but not all of them. And these users trade stories about dialysis. They talk about their experiences. They talk about the different treatments they're on. And they say that they find it to be very both emotionally and informationally supportive. So that's a place that I would really encourage people who are looking for that kind of personal information to start looking there.
I think that's, again, just understanding that there is this need for an effective kind of approach to information seeking in the health sciences, and that maybe in years past we really didn't optimize that or really consider it as seriously, because I want to know what I'm going to be feeling, not just what my best options are in terms of treatment. There's a lot more to really living with an illness than understanding what drugs I'm taking or what my options are in terms of surgery or physician treatment or choices in my doctors. All of those things are important, but it's a holistic approach that I don't know that we considered it as information professionals before. And it also recognizes the value of user-generated content and online communities of support and practice, perhaps. And of course that's opening a can of worms in some ways, because we're used to putting some kind of peer-reviewed seal of approval on the information that we share. How do we know about the quality of this information, and what kind of disclaimers might we have to share with the folks we work with to make sure, hey, somebody might say this, but you have to decide what its value is.
Mm-hmm. Well, I think you say exactly that. And I think that's true of any health information you find online, especially as an information professional. Again, stressing that the stuff you find online isn't medical advice, and you really shouldn't use it without talking to your doctor, whether it's a personal story, whether it's information that you're finding on Medline Plus, which is a vetted resource, right? Whether you're, clicking on an advertisement, right? One of the more sort of frustrating things to see and to hear about is people who look, for example, they look for information about kidney disease and then they get bombarded with these ads about curing their illness. That's common, and that's very frustrating as an information professional to hear, because kidney disease can't be cured, right? A lot of these illnesses, a lot of chronic illnesses can't be cured. They can only be managed, right? And so trying to make that clear and trying to sort of do some of that sort of information literacy education of, think about where the information's coming from, make sure you vet the information with your provider, what's online might not be right for you, right? But like you say, that affective component really matters, especially when you're talking about a chronic illness that's just going to be a new normal, right? People really want to.
I think that also brings up another bucket that we may not have thought about, and something that personally was really important to me. I don't know if I shared this with you, but I had a friend who had a brain tumor. Did I ever share this with you?
I don't think so.
And what was going on, and I'm not sharing anything that's really illegal with you because I cleared it, but what happened was she could not, because of the firewalls of the databases, she was a really intelligent woman who was looking for information that was incredibly current and incredibly sophisticated. She wanted to discover what the new clinical trials were. She wanted to know what new doctor treatments were. And she wanted to know it immediately because time was critical. Mm-hmm. And so I could get into RSS feeds and set them up from Elsevier and ProQuest and EBSCO databases. And I'll try to tell this story quickly. And she would feed me keywords that I didn't understand from this is the thesauri, and I just plug them in and I download PDFs and send them to her. Mm-hmm. And I did check this out with my friends from the database world. I let them know what I was doing, and they would. She would funnel them to a couple of people. Mm-hmm. At her funeral, I met a guy named Jeff who said, "Thank you for what you were doing," and I am using Paperly and possibly some other things to create a kind of current awareness service for folks in the brain tumor community. Mm-hmm. And so what he was doing was leveraging social media curation tools and finding the best sources for medical news, pulling them together in a kind of quilt of patchwork quilt, or it's their own medical magazine, taking stuff from the Harvard Health newsletter and stuff from Cancer News and stuff from the American Cancer Society, pulling it all together. And so when there was news, it was all in one place. And I imagine there are a lot of people who are not doctors and not librarians who are doing this kind of current awareness for others in the community. And it might be helpful to be aware of that kind of service as well.
Definitely. And actually, you remind me, there are a lot of Twitter communities where they have weekly chats and they use the same hashtag every week. And it's a group of usually providers, patients, and caregivers who are all chatting about a specific topic. So the one that I can, that comes to mind most readily is there's a breast cancer group. Let me see if I can remember what it's called. But searching the disease and the word Twitter, right, is a good way to maybe find communities that are talking on Twitter, right? And I can't find it right now, unfortunately, but I think it's BCSE or something like that. But there are Twitter groups that have both professionals and patients, and then just people who are interested and curious. Also, one of the things that has come up a lot when I speak with people is this idea of keeping current, right? And of knowing what's actually going on in the medical literature right away in clinical trials, like you brought up. So another really nice resource is clinicaltrials.gov. Let me bring that up. And clinicaltrials.gov allows anybody to search for clinical trials that are currently going on or then that have closed as well, right? So you can actually put in studies, you can see them on a map, which is really nice. and it's your real Facebook identity that's there. And so just that gentle reminder of, you know, things that you put online are not necessarily private things. I think that's always a good thing to remind people, especially in this particular context where some of the ramifications could be you know, potentially harmful to people.
Thanks. I'm going to stop the broadcast, but we're very grateful that you joined us, and I'm sure my students will benefit from all this information.
Well, thanks so much for having me. I really enjoyed chatting.
All right, thank you.